a good question for you, just out of more interest, I think,
Mm-hmm.
than any. Stress, burnout, and mental health. How do you see them coinciding, or what's the difference, and like how do you differentiate them, in your opinion?
Yeah. So I think the easy one to link there is burnout and stress, because the way that I try and explain this to people when we do work together, that stress, you can be stressed about any scenario in a positive or a negative way. So there's the stressor, which is whatever, and it can be anything that happens external, and then the stress is just the internal response to that. So technically, if something is happening and you're getting really excited about it, technically the stresses in the body, but we don't really word them that way. We word it as, I don't know, if it's nervousness or anxiety or just really looking forward to something. So they're quite easy to link. And the work that I do with people who are feeling angry due to stresses at work, it's identifying that all these scenarios happen and all of them do put stress into the system, though you might not see it that way. And then even then, it might not even be anger. If you understand more about like the emotions that you can have and wording them, they can be completely different things to anger. So it's dead easy to link burnout and stress. I think the definition of burnout has the word stress in it. So that's an easy one. The harder one is mental health, absolutely. Because I know there's multiple articles around, is it burnout or is it depression, for example, or is it burnout or is it anxiety? And I think they can easily be overlapped, where if someone's dealing with burnout, they might be dealing with depression and maybe dealing with anxiety as part of that, which makes it really hard to separate and pull apart. But you have to be really careful, don't you? Where it's similar, it's like the difference between having depression and feeling depressed.
Yeah.
Where you might feel depressed, but that doesn't necessarily mean that you are managing depression. And that's an easy trap to fall into, I think. So I would argue that one is they should be taken seriously in their own right. Absolutely. Those some of the symptoms link.
Yes. I think why I've asked that is because when I first started this over a year ago now, first podcast speaking to someone, it was purely mental health. I was under the impression that I had mental health issues. I was depressed and these sort of things. But literally speaking to you for 22 minutes, I've decided that I was burnt out and that I wasn't depressed, which it might be wrong diagnosis, but I think it's also really important because mental health is a spectrum, which I'm sure we'll go on to in a second, in a bit with the other stuff that you do as well, is so vast and so large, yet there's so many problems that are either ignored, one, which is probably the worst, or two, linked in as like low-level mental health, whereas ironically, they're the extreme version of the thing that's ignored. So like extreme burnout, based on everything that you're saying, could have the same effects on someone as mild mental health, for example. So this almost nether zone, grey zone that's only just really starting to be spoken about is where, for me personally, from everything that all the people that I've been speaking to, and the more that I look into this, this seems to be the area that's actually causing the most problems. And mental health is just a term that's been brushed, sort of folded over the page to say, oh yeah, that's mental health as well. And I don't know, what's your thoughts on that?
Yeah, I agree. Or that people are self-diagnosing, which is, I remember being told. So back in the days when I used to deliver cognitive behavioural therapy, we used to get counselling as part of that, because you're obviously taking in a lot of very sensitive stuff and scenarios. And I remember my counsellor at that point saying self-diagnosis is one of the most dangerous things you can do. because you then say, well, it's this. And then you'll start, what we're brilliant at is then pulling every bit of evidence that agrees with that statement and then ignoring or blurring the bits that aren't. And then you can end up almost feeling like you've got whatever that is.
Yeah.
And it might be the case, but it might not. Yeah. So, I think there's an absolute risk, and leave it to the professionals to be able to diagnose, which I know is very difficult in itself, especially in the world of, let's say, ADHD, which is a big thing that's coming out at the moment. Very, very difficult to diagnose, and what tools are there to do that. And, it's people are coming out with saying they've got the symptoms. They might and need to work out or find out if that is the case or if it's something else. You're right though. It's a grey area.
Yeah, it seems it needs more people talking about it, which is good. I'm glad. Funny that. Got a headache. Google it. Right, I'm dead in a week.
Absolutely, yeah. And the first thing I tell people is if they are at the point where I was, like lying on your lounge floor, looking at the ceiling, thinking I cannot take anything else, then my bit of advice is go to your doctor. That is not the time to talk to, like, even myself at that point. Absolutely, I'm here to help. So pick out some of the symptoms that's on the way towards that, or spotting that in yourself or in your teams, and then what you can do to help reverse, to prevent getting to the point where you go off, where you take months off, where you leave your job or quit, or all these things that can happen. But if it's at the actual point of full-blown exhaustion, go see your doctor.
Okay, that's sensible action, right? So what